I think for doctors, it's important that they tell the patients that psoriasis is not only the patients but also everyone, that psoriasis is not contagious. It's a manageable disease. Although psoriasis, as we know it, sometimes it's a severe chronic and non-communicable, disfiguring, and disabling disease.
Okay.
Since psoriasis manifests on the skin, on the outward look
Yeah,
of a
we have the
person.
photos in the screen,
Yeah.
actually. Okay.
So people, those who don't know about the disease, they stigmatize these patients. So it's important that we spread awareness that it's not infectious.
Dr. Lyra, that point of Catherine, it speaks to me because for the longest time, I had the impression, or people have the impression that psoriasis, pangmayaman lang yan. Sakit lang yan ng mayaman because it seems that only the rich really, or well, I don't mean to be judgmental, I'm not being, whatever, but it's the rich people or the people who are well off who actually talk about psoriasis. I've never really heard of, someone in the CD bracket saying, alam mo, Kuya Sito, I have psoriasis. It's always my friends who are well off and it's like, sakit ba yan na mayaman? Ano ba yan?
Well, actually, it doesn't matter whether you're rich or you're poor. You can get the disease because the cause is genetic. It can be genetic with some trigger factor. So it's not lang only a sakit ng mayaman, but probably
Mina-mana. Okay.
Probably the reason why richer people get diagnosed is because they seek consult more often than the ones that the lower socioeconomic class.
But you go to a doctor because you're in pain. What is the what are the indicators of psoriasis? I mean, is it painful? Because I know allergies Makati. Yeah. Oh.
Mostly the patients with psoriasis, as mentioned by Dr. Kathy, they manifest with skin lesions.
Yeah.
So the skin lesions usually, there are different types actually, but most of the time they're visible. So they can be as red, flaky, we call it plaques, raised lesions that can be itchy, sometimes painful also because you get cracks, open wounds. So that's the time they complain of pain. But aside from the skin lesions, patients also develop arthritis. They are more prone to have that because together with the skin manifestation are joint pains. So that's also one reason they go to doctors because they experience joint pains as well.
Yeah, but this is psoriasis, ladies, and free for all tayo, no? Not a Q&A. Is psoriasis something that you call progressive disease?
Yeah, it can be progressive. It may start as mild, very few lesions, or very mild joint pains, but it can progress when not treated or not managed properly. So they can be as bad as involving the whole body. The whole body becomes red.
Yeah,
becomes flaky.
based on those photos, Doctora, I was shocked. I didn't realize that there were people who, even kids. I thought psoriasis was an adult, rich person's disease. Sharky.
Yes. So anyone is at risk of having psoriasis, but mostly if there's a family history of having psoriasis, then you're at higher risk.